Today, I will be demonstrating the muscle energy technique for treating a left unilateral sacral flexion. This technique is based on the methods described in Atlas of Osteopathic Techniques by Nicholas, pages 330 to 331. Let's diagnose the somatic dysfunction with the patient seated. I place my thumbs under the inferior aspect of their posterior superior iliac spines. I ask the patient to bend forward. We see the left thumb moves superiorly, indicating a positive test on the left side. With the patient prone, the left sacral sulcus is deep. The left inferior lateral angle is posterior. A negative spring test indicates sacral flexion. Next, I ask the patient to prop up on their elbows for the Sphinx test. In this case, the sacral sulci become more symmetrical, indicating a forward sacral base. Let's proceed with the muscle energy technique to correct this dysfunction. The patient lies prone on the table. I abduct the patient's left leg to find the loose packed position of the left sacroiliac joint. I internally rotate the left hip to gap the posterior aspect of the SI joint. I place the heel of my caudad hand on the patient's left inferior lateral angle. I reinforce this hand with my cephalad hand on top. I apply a constant anterior superior pressure. We can use respiratory assist by instructing the patient to take a deep breath in. I maintain and slightly increase the pressure to enhance this motion. As the patient exhales, I maintain the pressure to prevent the sacrum from returning to flexion. We repeat this process for 5 to 7 breaths. I return the patient to a neutral position. Let's reassess. The ILAs and sacral sulci are now symmetrical. The spring test remains negative. In a Sphinx position, the sacral sulci remain symmetrical, a negative seated flexion test. These findings indicate that the left unilateral sacral flexion has been successfully corrected.